Serious, doctors and nurses of Reddit, what was the creepiest, scariest thing you heard from patients before they died? I work on a ward for elderly with dementia. We had one patient who was pretty well in the beginning stages of dementia. She had very little medication and could still do a lot by herself. One day I put her to bed like every night and she asked me when I would be back. I told her I had an early shift and would see her in the morning. She looked me in the eyes and told me with a smile that she won't be here. I asked her why not, and she told me that she would be dead. I discussed this with a fellow nurse because it was something she had never smid before and decided to check all her vitals. Everything was well within limits, nothing raised a red flag. But when I came to work the next morning they told me she passed away an hour before my shift started. I still find it creepy how she could have known she would die that night. When you know, you know. Had 3 patients all pass away within a week. They were all on different parts of the ward and all asked who the little boy in their room was, and within an hour of asking passed away. 10 years from now I expect to see a viral post on social media where a teenager recounts that time he got seriously lost in a hospital, somehow managed to hide from all of the doctors and nurses while trying to find his way back, but thinks he might have frightened some people to death on the way. We had a patient who came in frequently trying to OD to commit suicide. The last time we cleaned out her stomach she wasn't doing well. She whispered something to the effect of "OMG. This time I did it." She died in the ICU not long after. My dad had a major stroke and was in the hospital for several weeks. He wasn't in much pain, but he also wasn't aware of what had happened to him, and was conversational, but a lot didn't make sense. One afternoon his wife and I were sitting with him when he said, out of the blue, "It's time to die now." We looked at each other and she said incredulously, "Can he do that?" He hung on for a few more weeks, but not very lucidly. Transfusion dependent leukemia patient. Wait, so you're saying I don't have to do this anymore? Me. No, not if you don't want to. Him. Me. I'm gonna go get a sandwich. I'll check on you again in 15 minutes. Him. Dead when I get back. I guess he didn't want to do it anymore. Last week I took care of an older lady in septic shock, transferred to ICU so she could get levo-fed. She was getting a little more disoriented as my shift progressed and kept saying, "I'm so scared. I'm so frightened." When I asked her what she was afraid of, she said she didn't know. I kept reassuring her that we were taking good care of her. She ended up coding and dying that same day on night shift. They always know. My great-grandmother went into a shock when she came to know my father passed away. We did not tell her about it, but she overheard a conversation a couple of weeks after the cremation. Within a few hours she had completely forgotten our mother tongue and could converse only in English and Bengali, which she had not practiced for more than 80 years. The next day morning she told us that her parents, husband, daughter, my grandmother, and grandson, my dad, are waiting outside for her. She closed her eyes and was gone. My grandma was dying of lung cancer. She would always talk about dreams of fishes when someone was pregnant. The only people who knew my girlfriend and I we expecting was us, and she wasn't even showing any signs, along with wearing baggy clothes to hide. My grandma had told me congratulations and that she and our baby are beautiful in the late stages. She ended up passing about 5 or 6 days later. Fast forward 2 years. My mom and dad have a picture of that same grandma and my grandpa hanging up. My grandpa passed some time before her, so my kids never got to meet them. My 2-year-old pointed at that picture and knew it was his Papa Gary. Okay, so I'm blown away by this because it's the same thing with my dad. My dad dreams of fish when someone is pregnant. He's had this dream many times throughout his life and he's always right that someone he knows is pregnant. I'm not in the medical profession, but the last thing my sister said to me was, "I've had enough now. Time to go." I think she died a few hours later. This one got me. I'm so sorry for the loss of your sister. When I was a student, a dying woman told me congratulations on the baby. She will have beautiful blue eyes. I was confused because I was 18 and I wasn't pregnant or planning. But 3 weeks later I find out I'm pregnant and my girl have blue eyes. I haven't had creepy or scary patient deaths. I've held the hand of an old woman. She was little more than skin and bones. I believe she was actively trying to die while I held her hand and stroked her hair. She asked me why it was so hard to die and if it was this difficult for everyone. I will remember her for a very long time. I sincerely hope she found the peace that she sought. Other patient end-of-life events have been disturbing, but not in the way that I think this question is asking about. The fear in the eyes of someone about to be intubated. That sticks with you. Y'all have some conversations with your loved ones about your end-of-life care. CPR is brutal. Consider what you would or wouldn't want done to or for you. Talk about it with your family. Find out what their wishes are. It will make it easier if you ever have to make decisions for them. A lot of people die in a very similar fashion, in an untouchable discomfort and pain. Every time you ask them to rate their pain on a scale of 1-10 they say 10 and they just beg and beg and beg for help. And so eventually you just start to bring the morphine dose up and up, the Ativan dose up and up until that, combined with their illness, brings them into a state of unconsciousness that they stay in for a few days and eventually die. It's sad, but I can't honestly say it scares me. I'm confident that in the same situation I'll probably be able to take myself out before it gets to that point. Pre-opping a patient for an urgent, non-emergent surgery in the middle of the night 4 or 5 years ago. His IV was infiltrated, so I started to put a new one in before we went back to the OR. He panted, "Please, hurry up," then coded and died. Wasn't creepy necessarily, but painful and actually caused me a lot of nightmares for years. Context: I've been a nurse for 9+ years now. I became an LPN at 18 after graduating early and became an RN at 19. This is a ton of responsibility for someone so young. Looking back, was working on a medical floor. My first job. Had a 50-year-old woman come in as a direct admit from her DR's office, not through the OR, with chest pain, and started coding within minutes of me getting her in front of her spouse. She came back a few times begging me for her life while attempting to resuscitate her, but after hours of trying to bring her back she died in front of me. Dreamt about her begging for her life nightly for almost a year. Drank a lot of alcohol to cope. Made me very angry that her physician made the choice to not send her to the OR first because they were more equipped than the critical access medical floor I was working on without a physician. Anyways, I hope her family has found peace. A giant bald patient that everyone became familiar with shows up on the 5th floor asking if his family showed up yet. The nurse told him he was on the wrong floor. "Maybe they're visiting you on the 3rd floor where your room is," she said. His sad voice answered, "They're not down there. Goodbye and thanks." The nurse called the 3rd floor desk and informed them of their wandering patient. It couldn't have been him. He died this morning. She looked up and he was gone. We never heard the electronic door behind him open and never saw him again. Ooh, that's a creepy one. It would be extra creepy in the hospital where I work because the 5th floor is psychiatric care and you have to buzz in through 2 doors to get to a nursing station. I once had a patient who was super sick, close to the end, and just chilling the bed as the soon-to-die do. Out of nowhere they were suddenly, vehemently, terrified, screaming, saying things like "Oh God no" and "Please no" etc. Then died. Whole thing was probably 20 seconds. Master troll. Ich will nicht sterben. Bitte. I don't wanna die. Please. Sounds cliche, but if someone seriously tells you that with all his fear and panic and you're the only one this person hold on to, then it's freaking scary. You have that first rush of I have to do something but you can't do more. It's straight up traumatic when someone dies sudden, kind of awake before in an emergency situation compared to the sleepy sedative deaths over a few days. I was a CNA both in hospital and long-term care centers until I messed up my back. I spent many hours on light duty after I hurt myself holding the hands of people who had no family to come while they died. But my most memorable patient was when I worked in the hospital. We had an older gentleman who was a one and in full restraints as he died because the meds they were giving him actually made him very combative. Shortly before he died he managed to get out of all the restraints. Took about 5 of us to get him in new ones. He ripped out his eye and my shirt in the process. I will never forget him because of how restless he was before he died. It broke my heart honestly. Death throes. My mom had them too, just not that bad. Maybe not saying it right before she died, but grandma always said that sometimes some people don't die right away because they want to say goodbye to someone before they go. So when my grandma was dying everyone said goodbye but me, I just couldn't. I really loved my grandma. She was in the hospital for 4 months till the doctor said they couldn't do anything anymore, so I just stayed with her waiting for it to happen. When her breath started to get shallowed, I cried and thanked her for everything she had done for me and said goodbye. She died about an hour after that. About 10 minutes before I was supposed to leave because my cousin didn't have a ride and she knew I was there because I didn't want her to die alone. I truly believe she made sure I was there when it happened. I would have been so mad if she was alone. My husband's mother died in hospice on his 40th birthday. I think she was holding on for the day. He was her only son. My mother died 4 days after my brother's birthday. I am sure she was holding on for that. He was her only son and was her favorite. Not doctor or nurse. My grandma died the 7th of July, 2021 of brain cancer. Her last words, the 4th of July at 1:30, out of the blue, nobody came. She never spoke again. All she wanted was to see her family one last time. Her family left her. Nobody showed up for her annual the 4th of July party. She died 3 days later alone. Her husband died on Father's Day, 2013. My aunt took care of her. I feel bad for her, me, my aunt's boyfriend, my father, and my mother all showed up every day to help out. My other 3 aunts only went to take grandma's, their mom's, stuff and leave. My mom died of brain cancer on that exact same day. The last time I saw her was the 4th of July. I hope your grandma is at peace. I'm looking for my mommy, said by a 98-year-old man in my LTC facility. Dude was a full code, we sent him to the hospital. To quote his nurse, "Oh heck no, he's looking for dead people, I'm not jumping on his chest, performing CPR, tonight." So, I'm not a doctor or a nurse, but my aunt is a doctor, and she told me this story. So the patient had breast cancer, and she had no history of mental illness or anything, but my aunt said she seemed to be mad with grief. She cried and shook and laughed and screamed all in the same minute. And right before she died, she stopped. The last day she didn't say anything, she was just smiling. My aunt said it really scared her. It was the first time she had a patient die. I'm a little frustrated how in these experiences the healthcare worker isn't taking the patient seriously. How awful would it be to be near death and see a spirit and all the healthcare workers are shrugging you off? I can't imagine anyone wanting to go out like that now, having the last comfort of being taken seriously. Honestly, they don't say anything right before they die. Have been part of somewhere over 500 patient deaths and under 1,000. Best guess after a few decades in. The end is either quiet and peaceful where they slip off, or full of CPR and persistent medical folks doing their thing. It's not like to movies where someone whispers their secrets then closes their eyes and dies. The few days before the end can be bumpy if the patient isn't well managed. With pain and labored breathing, rando things get muttered here and there. Often they can see someone who has passed already. Some find it comforting and some find it disturbing, and then we up the sedation. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.